I'm exploring an aspect of life in Texas people don't like talking about. Abortion.
Pro-life, that's a lie. You don't care if people die.
3 years ago, the state passed HB 2. The bill had a disastrous effect, closing 26 of the 43 abortion facilities in Texas. And many of the clinics are still closed. In the Rio Grande Valley, over 4,000 square miles, Whole Women's Health in McAllen is the last clinic left.
The Texas legislature meets every 2 years. And as far as I can remember, every time the legislature meets, it turns into new obstacles for women to access healthcare and women to access abortion services.
Andrea Ferrigno is the vice president of Whole Women's Health, an abortion and women's health provider based in Texas.
These laws don't address any type of public health crisis going on in Texas. An abortion procedure is one of the easiest, safest medical procedures in medicine. And so all these added restrictions actually do the complete opposite.
At Whole Women's Health, anti-abortion forces have been unrelenting and sometimes even violent.
My sister's an escort. She was trying to get to patients. They shoved her out of the way to form a barricade around so my sister couldn't get to the patient.
These young women are on the front lines of the fight to keep abortion safe and legal in Texas. Each week, they escort patients to their appointments at the clinic in McAllen.
Since anti-choice legislators can't attack the actual legality of abortion because it's protected by Roe v. Wade, they attack all the access points of abortion. Like, we're going to make you travel farther. We're going to make you have to take time off from work, get childcare. And in that way, only women and people of a low socioeconomic status are affected.
So have you guys ever seen these restrictions stop someone from having an abortion?
Oh, yeah.
Appointment.
Absolutely, yeah.
Whole Women's Health closed in March, it reopened in September, closed again, reopened in October.
The area around the clinic is one of the poorest in the country, and since it's on the border, it's also home to a large number of undocumented immigrants.
So for the undocumented women who can't leave, what ends up happening to them if Whole Women's Health is closed in their time of need or they can't access it?
I've heard stories ranging from they do go back to Mexico and procure an illegal abortion and then stay with family until they can get back over.
To make the trek back across the border?
Right. And so at that point you're risking deportation and your life. And then also all kinds of old wives' tales about how to induce miscarriage, some completely ineffective, and then others just very dangerous. When it's closed, they still answer the phones and then help people find other clinics to go to. And so over the phone, the lady's saying, I can't do that, I can't travel. How about I just tell you what I have under my sink and you tell me what I can use? And that's the reality of the situation.